I read all your comments, and I've recently received a ton of requests to check out some injuries from the WWE or World Wrestling Entertainment. So per your request, we're going to be breaking down and reacting to some of the most insane injuries from the WWE's wrestling matches. Fair warning, this could get crazy. Before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Oh! That's not good.
Snapped his arm! Oh, God, no!
What? The way the arm is wedged in there in the forearm, you could definitely snap the radius and the ulna. If you catch it in a weird position, it could break. You know, it doesn't look like he's actually snapping at the elbow. Elbows are hard to dislocate. Typically, when you dislocate an elbow, it's a direct posterior force, so your hand actually gets hit here. The elbow goes backwards, so the olecranon is sticking out further. You know, it's pretty easy actually to put back in. You actually can just have somebody lay over a table or a bed, and you actually just push the olecranon back over.
His favorite equalizer! Oh my God!
When did I have missed these episodes?
Triple H just
Are you kidding me?
ramming hand of the Big Show!
You're gonna have crush injury to the fingers, and then you're actually gonna have explosion of the tissue. What do I mean by that? When you actually have compressive force so hard, the tissue lacerates itself by ripping open. Now you have an open fracture. Should be evaluated by an orthopedic surgeon. Question if the patient needs to be taken to the operating room to have it washed out and so it doesn't get infected, because you have a high chance of getting osteomyelitis, which is a bone infection related to an open fracture. So you need to be placed on an antibiotic.
Break up over the helmet. No. The ankle lock again. Wait, he's gonna try to break that ankle. Enough that he beat me. He's trying to incapacitate him. Oh my God, Connor. Kurt Angle.
I love the commentators. They're trying to break his ankle. It's trying to incapacitate him. Could you dislocate, fracture the ankle? Yes, you potentially could, especially using the different vectors of force. Did he actually snap it in this scene? Probably not. If you do, you basically snap the ankle. There's different types of ankle fractures. You can just have a medial malleolus fracture, or typically something that we call a trimalleolar fracture. But a trimalleolar fracture is an unstable joint where the mortise of the joint, where the tibia sits on top of the talus, the integrity is now gone, and you actually need surgery. Oh, what a cool move. Nice.
I'm not so sure that Rey Mysterio.
Knee right into the nose.
The face.
Taking a knee to the face, it's actually going to hurt the person who's actually kneeing him, but it depends on where on the tissue that it's hitting. And then broken nose. Okay, so people come to the emergency department all the time with a broken nose. It could bleed, it may not bleed. Most of the time, if you have broken nose, it's not set in the immediate setting because you don't know how crooked it is because of all the swelling. So typically what ends up happening is you allow the swelling to go down, then you go see your ear, nose, and throat doctor, and then it's reset thereafter. Oh, it's a big boy. Ooh. Oh! Man, how do these not cause massive injuries? The chair is kind of bent over the knee, hitting the femur. So, you know, you're not gonna have a patellar fracture from this, but the question ends up being, where does it pivot from? You're at risk for a distal femur fracture or a tibial plateau fracture on the other end. But if you get a distal femur fracture, man, those hurt like hell. You need to have surgery, you know, be able to walk again without having a rod. Same thing with a tibial plateau fracture. Again, the tibia comes up and it kind of plateaus where it articulates with the femur. All that force on top of that plateau, it needs to be reinforced with plates and metal as well.
No.
Oh, a crowbar to the leg.
Austin just broke that cane. Right.
Oh, and that was just
Go.
If your tibia is not conditioned, like mixed martial artists, their tibias are well conditioned because of all the kicking that they do. Your tibia probably is going to get pretty injured from a crowbar getting smacked to it and then somebody stepping and kicking on it. If it's hit in the right place and more on the thick part of the bone and the integrity of the tibia is still really intact, then it may not break. It doesn't look broken. If you're going to snap the tibia, it should kind of flop. Now you have the fibula that rides alongside of it. It's a non-weight bearing bone, but it still keeps the structure of that lower extremity. It still may not just flat there.
Oh, no.
Oh.
Oh. The ankle and the knee across the steps. Undertaker. Oh, no.
I mean, that was fake. So the knee is being stressed out. The medial collateral ligament as well as the ACL and the PCL are getting a little bit strained in that area. But the idea here is they're trying to take the stairs to snap the ankle or hurt the tibia. So on this injury, if they hit the leg, most likely they're probably going to potentially fracture the fibula. So the fibula is riding on the outside of the area between your knee and your ankle. It's a non-weight bearing bone. If it's fractured, it hurts like hell, but you can actually still walk on it. Shawn Michaels, yes. Oh man. Oh. Doing it against a pole. First off, he's getting his balls just hit right into a rail. You're gonna have trauma down there. Most likely gonna hurt more than anything. Could you cause a hematoma to the testicle? Could you cause like a rupture of the testicle? I've never seen one. I've seen testicles shot. I've seen scrotums ripped open. I haven't seen testicular damage from blunt trauma other than bad bruising. That is high. Oh! Oh, yeah, it's definitely gonna hurt yourself at the same time. A rule of thumb when it comes to like height injuries, typically if it's 3 times your height or greater than 15 feet, that's severe trauma, really intense, and you need to get checked out, like your full body, go to a trauma center. So this is pretty darn high. If you see him land, he has crazy whiplash. Because cervical fracture, one, you're also going to worry about paraspinal muscle spasms. Now he's going to have headaches. He needs a C-collar and a CT scan of the neck and possibly the head. Yes, Hulk Hogan. And the Undertaker. Is that the Undertaker with short hair? I think so. Nice. Give me some good handlebars. Yes! Over the top rope. It can cause some trauma depending on how you land. You gotta really be careful landing it with your arms out. A lot of times you fracture wrists with that. Then he uses his classic move of using his leg to hit him in the neck. Could that cause some discomfort? Most likely, yes. Especially if you're hitting right onto the trachea. You're gonna cause one, potentially injury to the vocal cords. You're gonna cause pain to the neck. But how much does the leg where the calf is actually hitting onto the neck causing that much issue? Because it's not like it's a hard, solid board. It kind of gives, right, as it hits. Does it knock him out? Probably not. Does it cause discomfort and maybe feeling like you might be suffocating a little bit? Yeah, for a short period of time. That is John Cena and The Rock. Nice. Rock lost all his hair.
Cena, no.
Oh.
Rock fight it out.
Oh, nice. These guys have to be so fit to get up, get down, picking up somebody 250, 300 pounds that looks like nothing. Obviously, they're working together to get the moves right and not hurt each other. They actually have to work together to make sure they don't cause serious injury, because as you're flipping, spinning, if you grab the wrong way, you actually can fork and rotate and cause a lot of ligamentous and tendinopathy, tendon injuries, tear muscle. Wrestling moves are no joke. Yes, it's for our entertainment. They are legitimately causing injuries to each other. The idea is to maybe cause a little bit of injury, but nothing permanent, to make it look real, because you can't really fake everything. But there are instances where it goes a little bit in the wrong direction and actually can cause major injuries. Super dangerous. So these guys are professional at what they do. I love it. Fantastic. If you like this and you like my reaction to this, check out this playlist over here. And as always, lay it down the smack on the subscribe button. And thank you so much for watching. Stay healthy, my friends.